How much vision loss is too much when it comes to driving? And how do you know when your vision is bad enough for you to stop driving? Hi there, I'm Dr. Audrey Tai, board-certified and fellowship-trained refractive and cataract surgeon, ophthalmologist, and cornea specialist. And today, I'm here to talk about your vision, safety, and car accidents. A recent study by researchers at the University of Western Australia sought to shed light on this question by investigating at what point declining vision increases the risk of a car accident. What they found is that the specific type of vision loss may be more important than your performance on the vision chart. This may be particularly relevant to us here in the United States because the number of American senior citizens who have driver's license have never been higher. In fact, according to the CDC, the number of U.S. senior citizens over the age of 65 driving has increased by a whopping 68% to nearly 48 million people over the last 20 years. Each state has its own driving laws, but states generally focus on central vision. Many states require drivers to have 20/40 vision or better in at least one eye to drive without restriction. In California, the DMV's vision screening standard is the ability to see 20/40 with both eyes together, with or without corrective lenses, meaning glasses or contact lenses. Visual acuity gauges how clearly you can see and is measured by reading letters on an eye chart. The test can tell you whether you need glasses or contacts, or if your prescription needs to be changed. Drivers who cannot pass the basic vision screening are referred to an eye doctor. The DMV does not test other types of vision, such as peripheral vision, color vision, or contrast sensitivity. The new study out of Western Australia may call the effectiveness of this practice into question. Researchers in Western Australia evaluated 29 years of data from more than 31,000 drivers aged 50 and older. Note that is considerably younger than the 65 and older population here in the United States that I mentioned before. Over 4,000 older drivers, accounting for 14% of older drivers in Western Australia, were involved in at least one car crash. More than half of those in a crash were experiencing some extent of visual field loss. The results were surprising because the researchers reported at the American Academy of Ophthalmology 2023 annual meeting that central vision loss in either eye was not associated with an increase in car crashes, while on the other hand, visual field loss of any sort in both eyes increased the odds of a car crash by 84%. They also found that moderate visual field loss in one eye increased car crash risk only if it occurred in the left upper or lower quadrant, whereas severe visual loss in any quadrant increased the chance of an accident. So what is visual field loss and why is it so important? Simply put, your visual field is how wide you can see effectively when staring straight ahead. A wide field of vision allows drivers to see enough details on either side of a car while still paying attention to what is in front of them. There are different types of visual field tests performed by your eye doctor or ophthalmologist. The one most commonly used in the United States is automated perimetry, in which you watch for flashlights in a special device. So if you have experienced decreased peripheral vision or visual field loss, be sure to see your eye doctor right away. Before getting behind the wheel of a car, it could save your life or someone else's life. If you have learned something new, please consider hitting the like button and subscribing to my channel to support more informative content on eye health and surgery. You can also follow me on Facebook, Instagram, and LinkedIn at Dr. Audrey Tai to learn more about my practice. Thank you for watching, and I'll see you in my next video.